Rheumatoid arthritis, RA, and chronic periodontitis are the most common chronic inflammatory diseases with remarkable pathological and clinical similarities. A lot of similarities exist between RA and periodontitis at both the cellular and molecular levels. The relationship between these two chronic inflammatory diseases is still unclear. This case-controlled study was undertaken to determine the possible association between chronic inflammatory diseases like RA and periodontitis. Among subjects with RA, there was no association between the rheumatoid disease activity and the severity of periodontal disease. The occurrence and severity of periodontitis was found to be higher in RA subjects as compared to subjects without RA. This suggests a positive relationship between these two chronic inflammatory diseases. Today we have Lisa Wadsworth with us, and she's going to be talking about implant dentistry and the role of the dental hygienist. Welcome, Lisa.
Thank you, Marty. It's nice to be here.
Lisa has more than 3 decades of experience in implant and periodontal arena. She began her career as a dental assistant, progressed to certification in implant surgical assisting, and finally earned a degree in dental hygiene. Lisa is a popular lecturer, has been an invited guest speaker at many major dental meetings. So Lisa, what got you interested in dental implants?
Well, it started 30 years ago as a young dental hygienist when implants first came into the United States. I needed an implant of my own. And it was quite an easy process and one that's been very rewarding for me, and becoming a patient was the start.
So now, when you're looking at the team, the dental team, how do we get them all on board with recommending dental implants to our patients?
I think it's all about education, Marty. Once the team understands and is able to understand what implant dentistry can do for patients, not only for their health and their self-esteem, but also to deliver treatment for patients who've been through trauma or cancer, what implants can do for their quality of life will help the whole team jump on board.
And then what about the case presentation? How do we get the patient to understand how dental implants can impact their lives?
Well, I like to think about a lecture title from my past, Hope, Health, and Healing. Patients need to understand, or should understand, dental implants from what it can do for them. Not about what we want to teach them about the technology per se, but how it will benefit their life. And if it's for hope, to regain their smile and self-confidence, is one thing. If it's for health, how do we feel if we're unable to chew? How do we go out in the world if we can't smile? And if for healing, what if it's a patient who's been a trauma victim of a car accident? If we're able to bring them back to the way they were before an accident and help their self-esteem and help them back into public, it's a wonderful thing.
How is the best way to educate patients on implant maintenance?
Maintaining a dental implant is as important, if not more important, than maintaining their natural teeth. So patients should understand from the very beginning of case presentation about accepting the treatment with dental implants that they are making a commitment to their dental health. They're making an investment and a commitment which they will have to take care of for the rest of their life. They have to know that even though it is the most natural replacement for a tooth that they've lost either to disease or trauma, it has to be taken care of like a natural tooth. So the importance of maintenance has to start at the beginning of the conversation and have their buy-in right from the beginning.
So then how would you present to a patient the benefits of an implant over a conventional 3-unit bridge?
Interesting question, Marty. Nature's way is how I would explain it. Once we lose a tooth, within the first year, the jawbone starts to resorb or dissolve in the space where the tooth is missing. But if we use a 3-unit bridge, that bone degeneration continues to happen. Once we place an implant into that spot, it actually helps regenerate and start to build more bone around the implant. In so doing, keeping the patient's jaw viable for the rest of their life.
Thank you, Lisa. That was great information. It was wonderful having you here.
Thanks, Marty. It's a pleasure to be here.
Dental implants are not just for the dentist to discuss. It's a whole team approach.
you.